Good morning, it's very good to be with you today. I was a delegate at last year's conference and I left with questions as well as answers for myself, and that has actually informed some of the things that I've been doing this year. And I hope that's going to be the same for you too. As Ollie said, I'm the strategic lead for this additional roles programme, and it's quite a new role because actually I think the formal recognition of that wider professional team in primary care is quite new, isn't it? But I thought I might start by just telling you a little bit about a workforce training hub, because there may be some of you in here who perhaps aren't very familiar with what a workforce training hub does. There are 42 workforce training hubs in England, and they give training, support and guidance for those people who work in primary care and those people who want to work in primary care. And you can see from this slide that we have projects that encourage people into primary care, so the pipeline part of it. We give support to people when they arrive in primary care, and we give training and support to people to help them flourish as they go through their career. And some of our values include that integration of the multi-professional team, the wider multi-professional team in primary care. That's one of the things that underpins what we do. And also trying to raise awareness of health inequalities through the programmes that we do. We've got quite a lot of nature slides, I think, between us today. So the South Yorkshire Workforce Training Hub as an organisation has been in place since 2014, and over that time has seen quite a lot of change. You know, things have moved on, and the view from the window now looks quite different to how it did then. Let's just think about that landscape and how it's changed, and Alf has talked a little bit about that. I don't know if you can remember 2014, and perhaps try 2018, because there was something big in 2018, wasn't there? Does anybody remember what we were celebrating in 2018? The 70th birthday of the NHS. It's interesting to think back that far, but some of the things that we celebrated then was that the NHS was still going, that it was still providing universal, free, at the point of clinical need care. But actually, there was a recognition that, you know, life wasn't necessarily rosy. And when we came forward to 2019 and the long-term plan came out, there was still recognition that funding was an issue, staffing was an issue, the health inequalities and the gaps that were opening and widening were there, and as we've said before, the ageing population was a big thing there. So NHS England proposed a plan. In fact, they proposed lots of plans, didn't they? But one part of that was a new service model in primary care. So 5 years on, the same concerns remain for many, I think. But some things have changed remarkably, and this report by the NHS Confederation, which was published in February, recognises some of the changes in the landscape that we see now. Primary care networks have been established across England. We've had this additional roles reimbursement scheme. I still think they could have found a better name for that. You know, that has been that mechanism to increase employment of a wider team, and through it, 34,000 new primary care staff have been employed. That's beyond the 26,000, which seemed a high target even at the beginning, and 50 million extra appointments. But we know that counting appointments is no good way to understand or measure quality. But what it is, these numbers are, is a way of seeing some of the things that are different since then. So I think outside the world can look a bit stormy, but this morning I want to spend a little bit of time just reflecting on some of the positive differences that we see, and some of the actions that we can take. Teams in primary care have changed over that time, and already change has brought opportunity. there are new perspectives and new stories being heard. The team is different, more diverse, there's a richer blend of skills. Last year in Doncaster and Rotherham, I did an evaluation of the additional roles that were employed in those areas, and it was a bird's eye view, it was high level, but there were still some key messages that came out about personalised care teams. Across the board, I was told about the impact of link workers, care coordinators and health coaches who were increasing access to services and improving health outcomes. Some PCNs told me that health outcomes were improving in ways that they hadn't anticipated, and they told me experiences that they had had. Somebody told me that link workers were magicians in their team, and somebody else described another role as the glue. A GP told me that after 30 years' experience, he had a completely new perspective of the population that his practices served after working with link workers and coaches. So there was clearly a shift going on, and although the view is challenging, and nobody would pretend it isn't, the view is changing in a good way because of the employment of 34,000 staff. But it's not easy to measure in numbers. Our traditional data sets don't always help us. But one thing I was reminded about at last year's conference was the importance of the lived experience and the stories and the power of that. And personalised care teams have many impactful stories, powerful stories, and patients tell us those. And I think part of what we need to do is work out how we allow the system to hear those in a way that means something for the system. A recent powerful story I heard was of a care coordinator, and this was from a patient, told of a care coordinator whose persistence in getting agencies involved to improve a family's housing situation had made such a difference to their child with worsening asthma, as well as to the family. And those outcomes were not expected by the PCN team who employed a care coordinator. So this is one perspective of the bigger picture, but what on the ground day to day? What matters to you if you're one of those 34,000 due to primary care staff? Well, I know that there are many and varied things that matter to you, but one thing that I'd like with my Workforce Training Hub hat on to matter to you is your training and your skills and your development. Through this presentation, I've just put one or two slides that it might be useful to come back to at some point. The questions perhaps will help you think more deeply about what matters and what you'd like to do to move forward. I don't know if you've noticed that when you're on the front edge of something, when you're part of the new way of doing things, the support mechanisms that have been in place to support the old ways aren't quite right for the new world. And the things that are well established for some members of the team aren't so well established for you, may not be accessible at all. And as I was talking to people for this evaluation, I noticed that there was a wide variety of experience of new to primary care staff. Some members of personalised care teams were really well supported, they had great training, they had good development, they had good support from their team, and they were really thriving and flourishing. But some were by themselves. They felt like they were working as individuals, and they didn't have people around them, and they were having to go it alone really, not only to work out what their job was supposed to look like on the ground, but what they needed and how to get what they needed. So I think to start with the basics, everybody needs core training for their role. Everyone needs specific training for their job and continuing development opportunities. Everyone needs line management support, and everyone needs some sort of supervision, and obviously that's dependent on what you do. But actually some of those things that I consider basics are not in place for everybody in these roles. And in the Workforce Training Hub, we know that accessing training and support can be a bit of a pick and mix experience. I don't know what it's like, where you are. I know in South Yorkshire we have PCNs who sometimes offer training. We have employers that, if that's different from your PCN, who might offer training. We have perhaps some training that is based in the place that you work. Some training might be offered by a range of other providers. Some training might be offered by the Workforce Training Hub. But you know, one of the biggest deals I found when I was speaking to people on the ground is actually finding out about training in the first place is a big deal. Then getting released for it is even harder. And that is even if you understand what you needed in the first place. It can be difficult, and you know, you might need to ask around. And you might need something different from the person next to you. In some of the roles that were the same in terms of the job description and the name of the role, there was real variety on the ground about what those people were doing in the day-to-day. And you might find that with some of the people that you speak to today. The more people you speak to, obviously, the more diversity you're likely to find. But what that means is when there is so much variety, actually it's very difficult to source the training that you might need for your role. There are so many individual profiles of personalised care roles. It's very exciting, but it's not always easy. And obviously, what we need through our working life might change as well. There are people who are new in role, you're new as a health coach or new as a link worker, or there are people who are very experienced but are new to primary care. And I don't know about you, but people who've been in primary care for a long time think that primary care is just normal and that's how it is. But obviously people who come into primary care for the first time, it's often a little bit different and they need some support. And what we found was that, I don't know what your experience has been, but getting core training, getting the first level of training for your role is sometimes relatively straightforward. At least that's one of the things that we found. But it's much more difficult to access some of the individual parts for your specific job. And the other thing is that there are always new training needs, aren't there? As teams come together to develop services, new things come out and there are new training needs. And how do we do that? The other challenge for people is supervision. And I don't know what your supervision is like. Sometimes it's because the people in the roles that I spoke to didn't think that they perhaps needed supervision or understood what that might be. Sometimes it was because employers didn't think that their employees needed supervision. But what we found in running some group sessions for people from personalised care teams is that they've really found it helpful, even if they weren't sure that they really wanted to come or needed to come in the first place. One person said, "This has been a lifeline for me." Another, "I was thinking of leaving, but I'm not going to leave now." I think the thing is, as we've said, it can be stormy, it's pretty tricky, it's not like being on an alpine meadow. Everybody needs support, everybody needs care to withstand the environment, we could say. And that's on a normal day as well as when it gets particularly difficult. And making sure that we have the right training, development, support and supervision often means that we can bring the best of ourselves to work. And often, if we are good in ourselves, then we can contribute well to a team. And we often bring our own unique set of skills, but have a greater impact if we work together. And the teams that I've come across over the last year are developing, well, they may have started looking like one team, but as their PCNs get to know more and more about their communities and more confident about the personalised care teams that they have, they develop and they change, and new groups of personalised care staff come together in different ways to do different things. So we have personalised care teams that support people with long-term pain, supporting people to get back to work, supporting people in care homes, those with dementia, those on mental health pathways, those with long-term conditions and mental health conditions, those with frailty or potential frailty, lots of different things, as you will from your backgrounds. But what we see is that all of these teams have different combinations of roles at different times along the pathway, and as they come together, they're really adding impact. And as they're doing that and evolving, they are widening their networks and their connectivity across organisations, across patient groups, with champions and expert groups and community-based support. But it is a developing programme. And as I'm really just trying to say, the first thing is to sort of sort out yourself and value yourself and your skills. The next thing is really to come together for maximum input. So look for opportunities to train together, look for opportunities to spend time together, because that's often what makes a difference in what I've come across as teams develop. And I would just say a note for anybody in the audience who can help with funding training. The traditional programmes that fund nurses and doctors and pharmacists in primary care are useful and important, but we have a multi-professional primary care team now, and often it's not easy to source funding in order to be able to plan programmes and training and support for those in the wider roles. And I guess just as it's important to mention that training needs are always developed, we should mention that working with others isn't always tidy. Sometimes it's a bit chaotic, but you might find that energising too. The same journey can look straightforward on one day and overwhelming on another. And this is the challenge of being in a changing environment on the front edge of the wave. You know, we're certainly there. And although there are many people working in very supportive personalised care teams, I guess I also came across, as I said, people who were working individually, isolated in pockets. And if that's you, I just want to finish by the reminder of three important things, which I've touched on, but I think if you do these, you can feel less isolated in that situation. The first thing is to find a community, and that might begin with finding a friend, basically. Anybody who works alongside you, who doesn't need to be in the same role as you, but somebody who is interested to understand what you do or what you could do. It may be a community of practice that comes out of some training. There may be an opportunity for supervision. Look for networks. The worst that can happen is somebody doesn't reply to an email. But making that connection with someone else, I think, is the first thing. Another thing that helps the world look a brighter place is if you're sharing what you're doing. And it may be that you can do that in a practice meeting, a newsletter, lived experience group, or a conference. Or just have a cup of coffee with someone. There are plenty of people to have a cup of coffee with today. Last week in South Yorkshire, the Training Hub ran a conference called Powering Progress, and we brought people together who were doing good work, really to share what they're doing. And one of the things that will come from that is more sharing, more connections, more spaces to share, and less isolation. And that makes the challenges of dealing with a difficult time or with change easier. And the third thing is to bring a brick and to contribute something wonderful. It may not be clear what that building is going to look like at the beginning, but it will be a better building if everybody brings their own brick. But everybody does have to summon the courage to bring their brick. So, to sum up then, sometimes the outlook is stormy, the work is overwhelming, the perspective is a bit daunting. On another day, it's a beautiful day, the work is engaging, and the path looks straightforward. So however it looks for you today, tomorrow, next week, value yours and others' diverse skills. Look for opportunities to work and train with others. Build a network, share your work, bring a brick. The view is changing. Thank you for what you bring, and please continue to be part of that vision for a brighter day.